Hi, I'm Lauren, a pharmacist at the University of North Carolina at Chapel Hill. I'm going to talk to you about starting an oral contraceptive pill, also known as a birth control pill. The birth control pill can be used to prevent pregnancy or for many other purposes. The first step is deciding when to start the medication. There are 3 different methods that can be used: quick start, Sunday start, and day 1 start. Quick start is the most common method and involves starting the pill today while using a backup method such as a condom or abstinence for the first 7 days of use. The pill will not start working immediately for contraception with this method, which is why it's important to use another contraceptive method or refrain from sex until you have taken the pill for 7 days. The next method is Sunday start. For this method, you will start your first pill on the Sunday after your menstrual flow begins. When using the Sunday start method, you also must use backup contraception, such as condoms, for the first 7 days of use, if it has been more than 5 days since menstrual bleeding stopped. And the last method is day 1 start. With this method, you will start your first pill on the first day of your menstrual flow. When following this method, you are protected against pregnancy as soon as you start. With whichever method you choose, you will begin by taking the first pill located in the upper left corner of the pack. This pill is labeled Sunday, so if you are starting your pill on any day other than Sunday, you can use the stickers that come with your pack to place over the days at the top of the pack. It's important to take your pill at the same time each day. The effectiveness of the pill depends on your consistency. So choose a time that is most convenient for you and set an alarm to help you remember to take the pill. Most types of oral contraceptive pills include 3 weeks of active hormone tablets and 1 week of inactive or placebo tablets. Some packs contain 24 days of active pills and 4 days of inactive pills. While taking the inactive pills, whether there are 4 or 7, is typically when you can expect your menstrual flow. These inactive pills are included to help you remember to take your pill every day. Some inactive tablets contain iron to help restore the iron that is lost during menstruation. After you finish the last day of your pack, restart with day 1 of the next pack. Now we're going to talk about what to do if you miss a pill. If you are less than 24 hours late taking your dose, take the late pill now and then take the next pill at the time you usually would. If it is more than 24 hours but less than 48 hours since you should have taken your pill, it is considered missed and you should take the missed pill immediately and then take the next pill at the time you usually would, even if that means taking 2 pills on the same day. Emergency contraception, such as Plan B, is usually not needed in this case, but can be considered if hormonal pills were missed earlier in the cycle or in the last week of the previous cycle. If you are more than 48 hours late taking your pill or 2 or more pills have been missed, take the most recent missed pill now and continue taking remaining pills at the usual time. If pills were missed during the last week of hormone pills, finish the hormone pills in the current pack, then skip the hormone-free pills and start at the beginning of a new pack. If you had penile vaginal sex in the last 5 days without additional protection, such as a condom, take emergency contraception. And use a backup method until you have taken 7 days of active pills in a row. Side effects that may occur while taking the pill include bleeding between periods, also known as spotting or breakthrough bleeding, breast tenderness, headaches, and nausea. These side effects do not occur in everyone, and if you do experience them, they typically only last for the first few months. Persistent minor side effects might be eliminated by changing the type of birth control used. Serious side effects that are not common but may occur include migraine headaches, elevated blood pressure, and blood clots that may appear in the leg, arm, or lungs. The risk of a blood clot is highest during the first 6 months after starting the pill. If you experience any of these serious side effects, contact a healthcare provider immediately. Warning signs of a serious side effect include severe abdominal pain, yellow skin or eyes, severe chest pain, severe headaches, vision loss or vision disturbances, and severe leg or arm pain or swelling. Remember, the pill does not protect you against STIs or sexually transmitted infections. A condom should always be used to reduce your risk of STIs. Usually your prescriber will provide you with a prescription for a 1-year supply of your pill. You will receive either 1 or 3 packs at a time from the pharmacy. When you are getting close to the end of your last pill pack, remember to call the pharmacy for a refill. If you have any questions about your oral contraceptive, call the campus health or student stores pharmacy to speak to a pharmacist or contact your provider.